What do we mean by the term neurological safety? You'll hear this term more and more, different health professionals using references to safety. You must feel safe to progress in your health. You must feel safe to feel at ease in life. So, and really, ease is a good word for safety. It means feeling at ease. You're just relaxed. You're connected. You're warm. You're grounded. You're passionate. That's what we mean by safety. It sure wasn't a term that I used on the farm growing up. And many of you haven't used that term as well, but you'll see that particularly from practitioners who have studied the polyvagal theory, which is a way to look at human behavior based on the autonomic nervous system. So the more we look at that, the more we do realize that, yes, we need to be safe. But let's use the words that are easy to understand. We need to be at ease. Our nervous system needs to be at ease. And when it is, we can communicate well with others. We feel resourced. We feel present. We feel like we can make great changes in life, and we feel like things are going well. When we move out of that, we move into fight or flight. We get mobilized to fight or to flee. And that is the sympathetic nervous system response, which leads us to feeling out of control, feeling like things are too much. We're mad about stuff. We're confronting stuff. I'm going to fight them. I'm going to beat them. They're not going to get the best of me, etc. And then we have faster breathing. We have a tight chest often. We feel impulsive. We're hard to think clearly. We may react before we think. All of that ties in with a sympathetic response, and that's going to shut down digestion. And you'll see pupils will be big. You'll feel this adrenaline rush in the body. So heart rate will be up. And that's the sympathetic response. And then we have what's in polyvagal called a dorsal vagal response. And forget, again, the big word I just used. Think about shut down and mobilize. So one's you're going to fight to flee. You're going to mobilize to fight or to flee. And the other one is you're going to shut down. And that's the lower aspect of the vagus nerve becoming more dominant. And there we feel more disconnected, dark, hopeless, helpless, shame and despair. And sometimes that is a good strategy for us temporarily to get through a big stress, but oftentimes it's a strategy that we've learned to take that doesn't really have any value for us anymore, and we're taking it out of neurological memory. And that's where our Quantum Neuro Reset Therapy can come in to help clear that out from neurological memory that we automatically default there. But when we're in those patterns, our heart rate's going to be lower. We're not going to have eye contact. We're not going to want to socialize with people. We're going to have low libido. We're going to have lots of pain. We're just going to feel shut down with life. And so we have to mobilize back out of that, and then we have to get back to what's called ventral vagal, the upper part of the vagus nerve, where we feel at ease. And that's what we mean by safe, feeling at ease so that you can feel connected, warm, passionate, grounded. And so we have specialized adjusting techniques. We do a lot of work on the front of the body because that's where our vagus nerve is, that's communicating all this information to our brain about whether we feel safe or not. And yes, the spine is important, the occiput is important, the cervicals, the sacrum. The other thing that's really important is our ribs, our breathing. Our ribs work 24 hours a day, so if they're not working right, we're not feeling safe. And so we have specialized techniques focusing a lot on the front of the body so that we can help a person feel neurologically safe. And then we have the QNRT techniques where we can help a person feel safe from the brain perspective, from the unconscious brain perspective. And that, we put those together, it's a game changer for a lot of people. And then we also have neurofeedback or computerized brain training. And all these things can make a huge difference in helping us feel safer, helping us feel at ease, and then great things can happen in our life. And so once we're at this ease and things feel like they're in a flow, it's amazing what will happen in your life. It's just amazing. And I look forward to helping you in that area. I hope I answered this question well about what is neurological safety. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.